Hello everyone, this is Dr. Krithika, Reader, Department of Oral Medicine and Radiology, SRM Dental College, Ramapuram Campus, Chennai. This is a short recap on dental considerations for diabetes mellitus along with its oral manifestations. Oral complications of poorly controlled diabetes mellitus may include xerostomia, which is reduced salivary secretion, which can be due to increased amount of urination, which leads to depletion of extracellular fluids and reduction in saliva secretion. There is increased incidence of bacterial, viral, and fungal infections, most commonly oral candidiasis, which is due to altered immune system function. There is poor wound healing, which could be mainly due to reduced blood circulation caused by microvascular dysfunction, resulting in reduced tissue oxygenation. There is increased incidence and severity of dental caries, which can be attributed to a reduction in salivary flow, altered oral flora, and also a change in pH, which becomes more acidic. The most commonly presenting signs and symptoms are that of multiple periodontal abscesses and periodontal disease. It can be mainly due to an enhanced inflammatory response, depressed wound healing, formation of advanced glycation end products, and the small blood vessel changes which contribute to the increased risk of occurrence and progression of periodontal disease in uncontrolled diabetes mellitus. Patients also present with burning mouth symptoms, which is mainly due to a reduction in salivary flow, and also diabetic neuropathy, which may lead to oral symptoms of paresthesia, tingling sensation, numbness, burning, pain caused due to pathological changes occurring in the nerves in the oral region. So, oral findings in patients with uncontrolled diabetes mellitus are most likely to be related to excessive loss of fluids through urination and altered response to infections, microvascular changes, and possibly due to increased glucose concentrations in saliva. Patients being treated with metformin might often complain of a metallic taste. This is a schematic representation of how a poor glycemic control could affect the general and the oral health, and also shows that the entire process is a vicious cycle. Stress is also an important factor that is to be concerned, that is to be taken into account, especially in chronic hyperglycemia. So, at the time of stress, energy mobilization is primarily a result of the flight and the fright response, as a result of which there is production of the ACTH hormone, which is the adrenocorticotropic hormone, which stimulates the adrenal gland for the production of cortisol. When there is an increased level of cortisol in blood, this results in increase in blood glucose levels, as a result of which the regulation of stress hormones may be very much abnormal in uncontrolled diabetes mellitus. So care should be taken so as to reduce the anxiety of the patient so as to maintain the blood glucose level. So, what are the important features that should be taken into account while giving dental care? So, poor glycemic control could lead to rapid progression of infections and can even trigger diabetic ketoacidosis. When there is inadvertent hypoglycemia, 4 to 6 ounces of fruit juice can be given when the patient is conscious. If the patient is unconscious, IV line can be established by giving 20 and then to give 25 to 30 ml of dextrose or 1 milligram glucagon or if IIB line cannot be established, then IM glucagon can be given. Appointments should always be given based on peak insulin activity, especially based on the drugs that the patient takes. If the patient is under metformin, then there could be a drug interaction with radiographic iodine contrast. While giving NSAIDs and when azole drugs are being given for the patient, it can trigger a hypoglycemic attack. Stress and anxiety reduction are also key factors to be considered while treating a patient with diabetes mellitus in a dental office. So, it is always mandatory to check for the fasting blood glucose level with a glucometer on the day of a dental surgical procedure. If the fasting blood glucose level is less than 70 milligrams per DL, it is necessary that we defer the elective treatment or give carbohydrates. Or if the fasting blood glucose level is greater than 200 milligrams per DL, again the treatment has to be deferred and give hypoglycemic agents and get a physician's opinion. So this is a comprehension of what are the factors and potential issues that is of concern in dental office while treating a patient with diabetes mellitus. Whenever analgesics are given, especially NSAIDs and aspirin, when care is to be taken to see if the patient is taking sulfonylurea drugs, which can worsen hypoglycemic attacks. Antibiotic prophylaxis are generally not required in controlled diabetes, but when it is uncontrolled and when we need to manage infections, aggressive treatment with antibiotics followed by incision and drainage if necessary, and also other treatment procedures like extractions, pulpotomy, warm rinses, and other emergency care has to be taken into account. Whenever local anesthetics are given, they do not pose a major issue unless and until if there is a history of hypertension or a history of recent myocardial infarction or cardiac arrhythmias. The dose of epinephrine should always be limited to not more than 2 cartridges containing 1:100,000 epinephrine. Bleeding disorders. So basically, when patients are treated with sulfonylureas, a rare adverse effect is the occurrence of thrombocytopenia, and this should be taken into account. Blood pressure. So monitoring of blood pressure is especially very important because most of the patients with diabetes mellitus also have hypertension. So, in case of acute oral infections and in patients with uncontrolled diabetes mellitus, insulin, it is important that the patients should be treated with caution. Non-insulin controlled patients may require insulin and consultation with the physician. Insulin controlled patients usually require increased dosage of insulin and consultation with the physician. Patients with brittle diabetes or receiving high doses of insulin should take a culture for the infected area so that better antibiotics could be given and the clinical response to treatment is better. Infection should be treated with the use of standard methods like warm intraoral rinses, incision and drainage, pulpotomy, pulpectomy, extraction, and antibiotics. Thank you.